So what does all this data mean? It means that we're moving into a new phase, and that we've made a decision that the mask mandate that we put in place after the initial January surge to really try to help in flattening that curve and helping pushing that down, protecting every Delawarean, is not necessary going forward. And so as of February 11th, we will be lifting the universal indoor mask mandate. That doesn't mean if you want to feel completely comfortable, you put on your mask yourselves when you go into closely populated indoor environments. I think about that all in the context of my visitations to my 90, this month she'll be 91 years old, my 91-year-old mother, and how much exposure I've had out in the public. What is the risk that I might be exposed to COVID, and the risk of taking that in to my 91-year-old mother, who, by the way, is very healthy. She struggles to get around a little bit, but she's very healthy. I wish her mask wearing compliance was better, but it is what it is. So effective Friday, February 11th at 8 a.m., mask will not be required by the state in these indoor places, convenience stores, grocery stores, gyms, restaurants. You'll remember, just think back a month or so ago, we didn't have the indoor mask mandate. The cases got so out of control in early January. I, as governor, decided we needed to do something. And the one something that I thought we could do to take that extra effort and to feel like we've done everything to protect our hospitals in particular and the hospital capacity was to impose a mandatory mask mandate for indoors. Whether it made a difference or not, I think it made some difference. I like to believe that any little bit helps. That was our reasoning going forward. You'll also remember when asked the question, how long are you going to have the indoor mask mandate? I said, not one day too long. Well, figuring out when that one day is not as easy as it might seem. We follow the data. We consider the spread of the virus in states around us. We look at the actions of those states. We look at compliance in our state, and then we make a decision in terms of what's the big thing. So we're moving into a kind of a more of an emergency environment where the government has a mandate for that kind of a compliance to your own personal responsibility based on the venue you're in, your health and wellness status, your pre-existing conditions or not, how prevalent COVID is in your particular area. And we expect folks to take that responsibility